Hi, I'm Dr. Louise Schumann. Thank you for joining me to learn some important information about your horse's dental health. My goals are to help you understand how dynamic your horse's mouth is, why your horse's teeth are important to his overall well-being, and what you can do to optimize your horse's dental health. A horse's mouth is one of the most dynamic parts of his body. It changes continually throughout life. Like people, horses have baby teeth, which erupt during the first year of life and are later replaced by adult permanent teeth. Between 1.5 and 4.5 years of age, all 24 baby teeth are shed, and 36 to 44 permanent teeth will erupt. Altogether, a horse's mouth will erupt up to 68 individual teeth by the time he's 5 years old. Unlike human teeth, which erupt completely into our mouths, essentially all at once, a horse's teeth erupt gradually over many years. Horse teeth have evolved to accommodate for being continually worn down by their coarse, fibrous diet. Their teeth have long, reserved crowns embedded in the jaws. They erupt into the mouth at an average rate of 2 to 3 millimeters each year. Under ideal circumstances, they wear down at the same rate as they erupt, so the overall height of the tooth in the mouth remains constant. In order for teeth to wear down evenly, they must grind against each other in a balanced manner. The horse's upper jaws sit slightly wider apart than their lower jaws. This conformation, combined with the natural chewing motion horses have, creates a pattern where the upper teeth tend not to wear down adequately along the edge closest to the cheek, and the lower teeth tend not to wear down adequately along the edge nearest to the tongue. This results in the formation of sharp points that can traumatize the cheeks and tongue. Horse teeth erupt at a faster rate until they are about 9 years old. This means that even after they are filed down, sharp points can reform quickly. Even as horses advance into the later years of life, their teeth continue to change. Horse teeth have a finite lifespan. Eventually, they wear completely out and their functional capacity becomes limited until they are lost altogether. It is critical to ensure balanced dentition in older horses so the teeth that have not yet worn out perform as much function as possible to compensate for teeth that have been lost. Yet another dynamic aspect of teeth is that they are vital structures. Each tooth contains a pulp of living cells, blood vessels, and nerves. Now that you're aware of the many changes your horse's mouth will undergo during his lifetime, let's look at why keeping his mouth healthy will enhance his general well-being. Good nutrition is the very foundation of overall health. If a horse is unable to chew normally, he will swallow larger particles which cannot be completely digested, and nutrients will pass through unutilized. Inadequate ability to chew puts a horse at risk for weight loss, diarrhea, impaction colic, and esophageal choke. Dental structures are intimately situated with the airways and sinuses. When infection develops in a tooth, it often extends into the respiratory structures. Nasal discharge is a common finding when there is an infected tooth in the upper jaw. The mouth has a rigorous blood supply. When infection develops in the mouth, bacteria have easy access to the bloodstream, which can carry them to other vital organs. Those of us who have had the misfortune to suffer from dental disease ourselves know that it is often very painful. Most horses work for a living, which requires they tolerate and respond to cues given by the bit. Since we want our horses to perform well and work happily, we must ensure their dental health and oral comfort. A horse's dental health status can be easily mistaken because outward signs of dental problems are often not apparent until disease is in advanced stages. You're probably wondering what you can do to make sure your horse's teeth are comfortable, functional, and free of disease. The solution is simple. Insist on a thorough oral exam at least once a year by an educated, experienced healthcare professional. The exam should be frequent and thorough enough to detect abnormalities in their early stages. That way, corrective action can be taken to prevent problems from progressing to the point where they are extremely painful and treatment is difficult or impossible. Unfortunately, there are significant obstacles for performing a thorough exam. Even when a horse's mouth is fully open, it is challenging to see every surface of each tooth because inside is dark. The cheeks are tight against the teeth, and the tongue moves freely, as does the head itself if the horse is painful or uncooperative. These challenges must be overcome to ensure a thorough exam without undue discomfort for the horse or risk to the examiner. If one cannot see and feel all the way to the back of the mouth, there is a good chance that displaced, broken, overgrown, overworn, and missing teeth will fail to be identified. Even more detail-oriented is the examination of the chewing surfaces of the teeth, which is equally important because horses can suffer from cavities and pulp nerve exposure. These are reasons that your veterinarian, ideally one with expertise on the topic, is best person to perform an oral exam and provide dental care for your horse. Again, thank you for taking the time to learn about horse dental health. Please don't hesitate to call or email us at Alpine Animal Hospital if you have questions or concerns about your horse's teeth or general health.